So the big issue today is exactly where you're at, is healthcare.
Well, and I'm worried about what the president is doing. I'm a supporter of the president. I'm a supporter of the concept of universal health care. I want competition with the private companies and with a government-operated company that is not greater subsidized so as to give it an advantage. But what I'm worried about is that the Obama plan appears to limit what private companies can do. Now, if I want to have gold-plated insurance, and I don't want to buy property, and I don't want to buy antiques, but I want to have insurance that will keep me alive even if I'm 90.
Right.
I'm 84 now. The New York Times has indicated that the Obama plan limits what insurance companies can do. I don't know whether it's true or not, but I believe it is true. And if that's the case, I'm opposed to that aspect of it.
That sounds very severe. I mean, really severe, that if you wanted to pay, and we're in a capitalist society, you should be able to buy whatever you want.
Exactly. Now, I understand we have to save money, and I would be supportive of restrictions on how much you can use government money to heal somebody. I mean, if somebody is 90 years old, I don't think government money should be used to give him a kidney transplant or a heart transplant. But if I want my own insurance,
to buy insurance for that, yeah,
and I will pay the bill, I want the right to do it.
Absolutely. And you think he wants to cut the... I don't know enough about this bill.
Believe me, the New York Times made that very clear that in the current bills that are pending, there is no single bill. There are restrictions on what insurance companies can do.
So therefore, if you wanted really to have great medical care, if you were 90 years old, you'd have to be an extremely wealthy person because you would not be...
Well, that's okay.
No, I'm saying, but that would be limited only to very, very wealthy people. A hospital stay like you went through without insurance is probably $200,000.
No, it was $1 million. My medical care, which involved 20 doctors and 72 nurses and technicians over a 6-week period, including 5 weeks in intensive care, where I was in real trouble on occasion. They told me will cost about $1 million, and it is not charged to Medicare because I'm still working, and therefore my primary carrier is my own insurance company. They pay the bill.
So they carried you?
Oh yes, I have gold-plated insurance, but that's what I want, and I should have the right to do that.
Absolutely. And Obama, he wants to do that in order to be able to take care of the people who have no insurance today?
Well, that's the problem. Obama is talking to the 47 million people who have no insurance for different reasons, and most Americans, myself included, want them to be covered. But he should be talking to those of us, many more, who have insurance and don't want it diminished by government action.
So you have to be a great voice out there.
I issue commentaries, and I think I'm adding facts to the debate.
I'm sure Fox News will take a tape from us now and play it all over the tube, especially Hannity and these guys who really love
And remember,
Obama.
I'm a liberal, but I
remember you went to Pennsylvania for him. You went to Florida for Obama.
Right.
I remember.
Absolutely, and I still support him. But that doesn't mean he's always right, and when he's wrong, I'm going to point it out.
So these protests that are going on today...
They're not unreasonable, except for those who don't give the speaker an opportunity to respond.
No, but there's a real vox populi against this bill.
Absolutely. People are terrified. And I don't think that the Obama administration is doing a good job in responding to their questions. What they should be doing is putting out a pamphlet, and also on television, of course, a list of the 10 or 20 fears that are untrue. Because there are people who are saying there's a death panel that decides whether or not you get treatment based on whether or not you're a contributor to the society. I don't believe that's true at all. But all those rumors have to be addressed. And then in addition to the false rumors and statements. He has to address the legitimate fears of which I have just referred.
You think there'll be a bill?
Yes, there'll be a bill, but if it isn't a good bill, the Democrats will suffer a defeat in the next election. Let me just say this. I'm so fed up with the members of Congress and the members of the state legislature in New York and New Jersey. They all have violated their obligations of office, I mean the legislatures. And if I had my way, I'd throw them all out. I'd throw them all out because they stay there forever. And their concern is to get reelected. So they allow the lobbyists, like, for example, in the New York State legislature. Who runs that legislature? The trial lawyers. And the trial lawyers also run Congress. How do they run it? They give them money, which is legitimate, and they say, we want you to support these various things. Now, when it comes to health care, if you don't have tort reform and limit all of these malpractice actions, which cost enormous amounts of money, you're not going to be able to pay for universal health care. But the trial lawyers say, you don't stand up for us and prevent such legislation, we won't give you a nickel. Or take what Obama did with the drug companies. I thought it was the worst thing I'd ever seen. The drug companies said to Obama, we'll support the legislation if you agree that you will limit any demand for us with respect to contribution by way of monies to reduce the cost of health care to a total of $80 billion over a 10-year period. Now, let me show you why that's puny and not really worthwhile to accept. The expenditure for drugs in this country, and George Bush never got the credit he should have gotten
Which
from.
one? Which Bush?
The second George Bush is the one who was responsible for giving everybody on Medicare coverage for drugs.
Right.
It cost $800 billion a year. Now, the George Bush people catered to the drug people by putting in the law, and it's still there, provision that says that the government, which buys most of these drugs under Medicare, cannot seek volume discounts. They have to pay total retail in effect, or total wholesale, however you want to put it, but no discount. They're spending billions. And the current president, Barack Obama, has acknowledged that he agreed with the drug industry that he will not change that law, nor will they change the law that prohibits Americans from buying American drugs that are sold in Canada at 50% discounts. Now, if you used just a 10% discount, and most discounts are up to 40, 50%, but just a 10% discount, the drug companies would be paying not $8 billion a year for each of the next 10 years, but $80 billion a year for each of the next 10 years. It is a sellout that is unbelievable. Now, Congressman Henry Waxman says he won't lie down on this and he will fight Obama. And let me just tell you, I think the country should be enraged. Why President Obama succumbed is beyond me.